Hello everyone, my name is Dr. Joel Rosen. I am an adrenal fatigue recovery ninja, and today I wanted to talk to you about dental mercury and adrenal fatigue. So a lot of the people that I consult with that have adrenal fatigue have brain fog, focus, concentration, anxiety, no energy, get up in the morning and just want to go back to bed because they feel like they've been hit by a Mack truck. They felt like they didn't get any restful sleep no matter how long they slept. They woke up several times throughout the evening. They have very little energy when they first wake up. They rely on coffee and caffeine and stimulants and sugars. They crash in the middle of the afternoon. They don't handle stress as well as they used to. And quite frankly, they're just not doing as well as they should. Well, I wanted to talk to you about the relationship of dental mercury. And so, dental mercury, if you listen to this video, you'll get a lot of information about how dental mercury can really be one of those things that are the invisible kind of, I'd say, the invisible, pernicious, or subtle thing that's going on in your body that's not so subtle and it's impacting your adrenals. And so you may be on adaptogens, you may be taking DHEA or pregnenolone or vitamin C or milk thistle, whatever it may be, and you're going gluten free and you're talking to a bunch of different natural healthcare providers and endocrinologists, and you're just at your wits' end. You don't know if you can get better. And well, that's what this video is for, because dental mercury could certainly be something that is impacting your health adversely. And what it does is it really slows down your ability to methylate. So I want to tell you what actually is methylation. Methylation, in a nutshell, is the act of adding on a CH3 group. And a CH3 group is called a methyl group. And so in biochemistry, we have these things that happen in our body, these enzymatic reactions that allow energy to be produced. And methylation needs to be handled correctly if we want to have any chance on detoxifying or fighting off an infection or reducing inflammation or making neurotransmitters. So that means you could have brain fog, anxiety, difficulty focusing and concentrating. You may have a lot of swelling and painful joints, and you may also just not being, you may have this adrenal fatigue issue. And so what happens is mercury, and that's a symbol Hg, mercury can really inhibit your ability to methylate. And that's where these MTHFR comes into play, or MTR, or MTRR, or something even called ApoE. And you'll get these on a genetic report like 23andMe or ancestry sites, and you'll find out about these enzymes that aren't working so well, and they don't make reactions happen as fast as they should. And so these stressors that you have, like your job or your finances or your health or your family's health or just the city you live in, whatever it is, these things are crashing you and not allowing you to produce energy properly. But more importantly, if you have a dental problem and you've had mercury, then potentially that's going to slow this thing down even further. I get a lot of people that ask me, hey, my dentist says that mercury can't, and there's no studies that show that mercury can slow down your body. And we just had a teleseminar that I'll attach to this link here. But basically, mercury is toxic to the body. And so the question becomes, does mercury outgas enough to cause toxicity in the body? And you got to think, if you've had these mercuries in your body for years and years and years, and you're suffering with an adrenal problem, at least behooves you to try to determine if there is a toxic burden in your body. So we do hair samples, we do blood samples, we do urine samples, and typically hair and urine are going to be the most informative. And then once we learn what the actual toxic burden is, we can attack a dental load on your body and try to help reduce the inhibition that's happening on your enzyme. So anyways, just want to give you an information packed video on what you can do. So what you need to do actually is A, look into getting a hair sample test, or B, get a urine sample test. Also, number two, try to get a genetic test done, 23andMe, and work with a functional medicine practitioner that can interpret that and put together a protocol for you. Actually, I'm having a group coaching program. Can't speak. The group coaching program is valued at over $9,500, and we're doing it for 12 weeks. We're accepting 25 applicants, and I'll give you the link to fill out an application if you want to be considered for this group. We already have about 15 or so people that are looking to become part of this group, and we're waiting for till we get 25 people. So I'll send you the link underneath this video so that you can watch the replay of our teleseminar, and also you can fill out an application. We're looking to get started at November 21st, so we still got a little bit of time here, and so don't miss out. And hopefully you got a lot of information out of this video today, and I gave you a little bit of an action step in terms of trying to understand your mercury load. And don't just get the mercury pulled out of your teeth. A lot of the times we'll have patients that said, hey, I started to crash after I got the mercury taken out of my mouth, and that's a problem because your body's not ready to handle that excess burden that your body's going to learn when it doesn't have as much metals in its mouth. It will start to over detoxify, and if you're not doing a good job of methylating or adding a CH3 group onto your enzymes or onto your substrates, then you're going to have a big problem. So once again, my name is Dr. Joel Rosen. Look forward to helping you in your adrenal fatigue nightmare. And if you liked this video, just give me a like, a thumbs up, a share, and I look forward to helping you in your adrenal fatigue recovery. Thank you so much.